Hi everyone, and welcome to this webinar on the Introduction to Advanced Assessment Technology. So this webinar is going to introduce you to PhysEquip's latest product offering, the AxIT system. We are delighted to be the first international partners of Strength by Numbers, and what a better way to kickstart this launch than with an informative session from one of the Strength by Numbers experts, Andrew Lemon. So Andrew will be going through a presentation for us today, and then followed by that, we will do a Q&A and a discussion with myself and Andy Thomas. So for those who have joined us live, then please feel free to pop some questions during the presentation into the Q&A tab, and we can address those at the end of the presentation. So with that, I'm going to hand over to Andrew for an introduction and then onto the presentation.
Thanks very much, Katie. Thanks for having me all. It's obviously a pleasure to be joining you from the other side of the planet here in sunny Melbourne, Australia. As you mentioned, it's a real, we're really excited as well to be working with PhysEquip in particular as our first international distributors as well. And, it's just great to be able to talk about something that we're incredibly passionate about, which is the use of advanced assessment technology in the form of AxIT, our strength and force measuring devices that are really designed to help everyday health and fitness professionals understand their clients better, get better outcomes, but also, save valuable admin time and help do their jobs a lot easier too. So before I get into kind of talking about that, the reason why we exist is that really what we've noticed over the journey is that health and fitness is starting to transition from that, very subjective, maybe qualitative type sciences to really becoming very objective. We're really finding that the use of health and wellness metrics are becoming adopted more and more, not only by actual clients and patients, a lot of them will be using technology themselves to be able to measure their own health and wellness outcomes and helping them achieve their goals. But we're seeing that translate now into the actual, the clinics, the businesses, the service providers as ways in which they can measure the effectiveness of what they do. And that's where AxIT really comes in. It's a tool that's designed to help those everyday health and fitness professionals do their jobs better, and really just designed to make things a lot simpler and easier to do when applying this type of technology. So in terms of AxIT, what is it? As I mentioned, strength and force measuring devices, but what does that really look like? So what we've actually got is an integrated system of force plates and dynamometer type products. Now, these are things that are not necessarily new. Force plates have been around since the 50s, and dynamometry has probably been around for just as long. But for a long period of time, these were tools that were really only found in elite sporting environments or maybe research laboratories. They were really designed for the higher end of, assessment type practices and things like that. Of course, as technology becomes more accessible, it becomes more affordable, and certainly AxIT is leading the way in terms of being a really great accessible option for everyday health and fitness professionals that are looking to upgrade their assessment with these type of tools, so that once again they can start to apply these tests that have been done for a long period of time with a lot of great evidence behind them, but using them in their local communities to help those individuals achieve better results. So AxIT is the combination of those different devices that all integrate together into a technology platform that allow for great data analytics. So in terms of being able to interpret results, being able to track progression, being able to see where clients are at, but also kind of facilitating other different testing environments with a range of different accessories, as well as then all the learning material that you need to be able to obviously understand how to utilize this equipment and being able to perform those type of tests. So what I really want to talk about then is how it's going to help you as an everyday health and fitness professional to be able to get the most out of such a product and what it's going to do for your, not only your practice, but how it's going to help your clients and how it's going to help your business. So the number one thing is that it's going to help you set baselines. Now, I've put in a couple of quotes here, and they're ones that I'm sure people who are listening have probably heard before. If you cannot measure it, you cannot improve it, or if you can't measure it, you can't change it. Now, I'm not sure which one of these two said it first or said it best, but I think the message is typically the same, right? For a long period of time, for us as health and fitness professionals, as I said, we've probably been doing things by feel. We've been kind of doing things by observation, and the unfortunate element of that is probably our own biases have got in the way of looking after people to the best of our abilities from time to time. Now that once again these type of tools are becoming more and more readily available, it does give us the ability to be able to have greater impact with the people that we work with. So the number one thing that AxIT's going to help you do is set a lot of baselines in terms of where your client is at. So, the typical presentation that comes in and sees you, you'll be able to know from the start, where this client's starting point is, which sets the foundation for being able to identify, I guess, what you're going to work on and how they're going to progress and do things going on from there. So baselines is a really important part of what you're going to do with your AxIT equipment. The other part that's very, very interesting is, it's going to help you in terms of identifying with your interventions and the things that you do as a health and fitness professional, whether or not they're having a positive effect. So when we look to the research, one of the things that we see is that when your client is in pain or discomfort or something along those lines, often what we'll have is a reflex reduction in the amount of strength or the amount of force that the client can generate. So it's a really great way to set, once again, that baseline in terms of how much force, how much strength your client has, and then understand whether or not your intervention, regardless of what that might be, is having a positive effect. So, for example, that might be something if you're a manual therapist of some type, a physiotherapist that does manual therapy or different treatment techniques. I know, for example, the guys at PhysiQuip, you guys have a lot of involvement with shockwave devices, and we're certainly seeing that with our clients as well. They might be using tools like shockwave with their clients to reduce some pain and discomfort, but sometimes it can be difficult to know if that's having a positive effect in the immediacy as well. So a lot of our users are using AxIT to be able to identify then, okay, after we do our treatment techniques, for example, like a shockwave session, is that client then actually able to generate more force or produce more strength in that local muscle group or that local movement as a positive effect to show that we're on the right track? So some really great ways in which AxIT can be used to kind of help with that. Of course, though, one of the main uses for this type of technology, though, is to really be able to show from those baselines whether or not your client has a deficiency or an imbalance in terms of their strength or their force production. So the classic way in which a lot of us have done this type of assessment is with things like our standard manual muscle testing. A lot of our viewers would probably be familiar with, testing something like a shoulder abduction strength test by just placing their hand up against the client's arm. They're then instructed to push up into the hand, and then the practitioner makes a judgment in terms of whether or not one side is stronger than the other, and a grading of how much weaker maybe one side is. The problem with that is that, once again, it's a very subjective measure. It's very hard to be able to tell a 10-15% difference in terms of strength with just your hands, but potentially that could be a clinically relevant finding with the people that you're working with. By using tools like AxIT, it allows us to be able to assess that individual and measure with a lot of great accuracy as to how much force or how much strength that client has in that certain muscle group or in that certain movement. The other great thing then about AxIT is that it helps to interpret that data for you on the spot. So, for example, we can then show, of course, those imbalances, the percentage of imbalance between each side, but also we can compare to some of those evidence-based references in real time through our product and through the application. Because the first thing that your client is going to ask you is, was my result a good result? So being able to show that client, so as we can see in the little image here, the ability to kind of reference that as a percentage of body weight and then compare to some of that evidence will be able to give you that context to your assessment to work out whether or not, is the client even but deficient, or, are they very strong, but maybe they just have an imbalance from side to side. All of that context is really important when it comes to making the best decisions for your client. So AxIT helps to do that. From there, though, of course, as well, you want to know that your intervention is having that positive effect. And as we talked about, that could be a treatment technique, that could be hands-on interventions, or, of course, it could be some exercise-based intervention. Nowadays, we know that a lot of the conditions that we see all the time benefit from strengthening, benefit from exercise type interventions that are all about improving the client's capacity to tolerate stress, generate more force, tolerate more force, all of these things. And it doesn't have to just be an athletic individual. We know that this fits on all sides of the functional spectrum. That could be, some of your office workers, weekend warriors, or, even some of your older clientele. Everyone benefits from strength and the ability to tolerate forces. What we need to be able to do, though, is know that the exercise interventions that we're giving our clients are having a positive effect. How often have we given our clients some exercises to do to which they've come back and told us that they've been doing them, and yet maybe they haven't had the positive outcome that we were expecting? Now, is it because the exercises that we chose aren't the ones that client needs? We can identify that with AxIT. Is it because our client wasn't doing their exercises effectively? Once again, we can have maybe an honest conversation based on the numbers that we see with AxIT. So being able to track that progression is really, really important, as opposed to just asking our client, okay, well, how are you feeling at the moment? How's it all going? Once again, a lot of subjective questioning. The numbers don't lie. It becomes really, really important to be able to show that progression. So AxIT does that, once again, all in real time with your testing, and makes it really easy to calculate that percentage of progression and whether or not that client is on the right track. So really, really, really simple to be able to do that through, one or multiple different tests. Of course, then the other thing, we've talked a lot about how it's going to help you from a practitioner level. It's going to help you make great decisions. It's going to help you identify whether or not you're on the right track. But, one of the things that for us as practitioners, I'm sure we all understand, we all know, is that we've got a lot to do, and usually we don't have enough time to do it. So AxIT is really also designed as a tool to help you as an everyday health and fitness practitioner to be able to get some of that time back by doing a lot of the heavy lifting from a admin standpoint. So simple things like being able to generate one-click PDF reports, so if you have to report to different stakeholders around a client, or just even generating reports for your clients themselves so that you can provide a higher level service, is really just the click of a button after you complete your testing session using AxIT. If you need to copy and paste some, notes around your assessment, once again, to maintain your compliance, once again, just a click of a button is there. And even things like being able to export your data in a CSV format, if you are the type of individual who likes to process that data in other ways, is really, really easy to do with AxIT, once again. So no manual entering or manual handling of your data. It's really able to be moved around very, very easily using this type of technology, which, all technology should assist in that way. So that's how it's going to help you. But what about your clients as well? What's it going to mean for them? And certainly one of the things that we find is that our clients these days are really engaged with the use of data and technology in the way in which they look after themselves and their health. Everyone's got an Apple Watch, everyone's got a Garmin, everyone's using a range of different apps on their phone to be able to track their wellness. They want to see that from the health and fitness professionals that they visiting and that they're entrusting with their health, and that they're also engaging from a financial standpoint to look after them. So being able to show that data and show that journey is more important than ever in that respect. So utilizing these type of tools and being able to construct and show, I guess, the story around a client's presentation using numbers can be a really great tool from an educational standpoint. We know that often the education of our clients is one of the key determinants for a great outcome. If the client doesn't understand what's going on with them, then how can they buy in, or how can they be motivated into the plan? It's very, very difficult to do. So being able to show that story, or tell, I guess, the story of what the client's presentation is, help them understand, help them explain it, is a great way to get them on board. And certainly then, if they are on board, they're more likely to stick out that plan. They're more likely to be compliant with their exercises. They're more likely to do the things that they need to do to help achieve a great outcome. And at the end of the day, great outcomes is what we're all about as health and fitness professionals. If we're not achieving great outcomes, we're not going to get, our clients out in their community raving about our services, generating referrals. And at the end of the day, for a lot of us as health and fitness professionals, we're all there to make a positive impact in our community. We're there to help people. And that's the best way to help more people, is to do a great job and deliver an amazing service. So being able to show that progression and tell the story around that client's health journey is a really, really important way. And numbers do that in a really simple and clear way. Finally, as well, AxIT is also designed as a tool that's going to help your business, and it does so in a range of different ways. So, we certainly see that AxIT is a tool that can help improve the retention of your clients. As we mentioned before, there are lots of ways in which it can really help with that. The data, the numbers, improving the motivation, the buy-in of our clients into their plan. They want to be able to see their progress. We also find that then, because our clients are engaged into that plan, they're more likely to undergo those reassessments too. Those reassessment milestones become really, really important pieces of the puzzle. And there's certainly things that can be done at different timeframes, whether that be early on in the care process, where you may be reassessing more frequently because the changes can be more frequent, or it could be the type of thing where your client is being reassessed on a greater time frame. So, for example, in a strength training or a strength building block, we might be reassessing our client every 4 to 6 weeks or so. Beyond that as well, what we see from a lot of our AxIT users is it gives them the ability to work with the asymptomatic client. So for a lot of us as health and fitness professionals, we're always kind of repairing the problems once the problems have already occurred, where we know that being able to be preventative can often be the most effective way for looking after people from a health and wellness standpoint. It's very, very difficult to work with people when they are asymptomatic if we don't have much that we can talk about, because if someone is moving well and, their body kind of feels good, there's not much that we can do if all we're relying on is our hands and eyes in terms of being able to determine what it is that we need to do. By using tools like AxIT, what it allows us to do is it allows us to be able to perform those almost preventative assessments of someone's physical capacity. We can look at our movements, like our squats and our jumps and our, different isolated muscle techniques and different isolated muscle assessments to be able to determine, once again, does that client have a deficiency from what they should have? And is that going to be a predisposing factor for some type of presentation in the future? Often for a lot of our clients, that's a really motivating way in which they can look after themselves proactively. People are more engaged with their health than they ever have been, and people want to take those preventative steps to stop those issues occurring before it's too late. So being able to perform those range of different assessments is really, really useful in terms of being able to look after our clients. So once again, working with those asymptomatic clients is a real opportunity for our AxIT users. Beyond that as well, for a lot of our users, it's a great way using this type of technology to increase new leads and see new clientele as well. So for a lot of our users, they're using this type of tool as a promotional opportunity to show how unique they are compared to maybe some of the other health and fitness services in their local community. And it really does help you stand out from the crowd when you're using something that is a bit techy, looks a bit cool, but also, once again, really helps those clients engage and understand in their health journey compared to maybe some of the services that other local providers might be providing that don't stand out as much as that. So you can really stand out from the crowd utilizing this type of tool and technology these days. You can also use these type of tools, once again, to engage in that community directly. So for a lot of our users, what we're seeing is that they're using AxIT and its portable nature to be able to head out to local sports clubs, local fitness facilities, local referrers, those type of people, and utilize a assessment or screening day as a great tool to be able to, once again, engage with people of the community. So, people are very interested, as we've talked about, in what are their health and wellness metrics. So being able to set up a station somewhere where the, people can come, they can perform a bunch of tests, you can show them maybe some of the findings and have a brief discussion about what some of your services may be able to do to help them is a great way for people to learn about you, as well as develop, I guess, those relationships with some of those key referrers, whether that be sports coaches or, kind of members of another local health business or something along those lines. You can develop those relationships and those referrals with those key stakeholders, once again, utilizing these type of tools, because it does really set you apart from some of the local competition in that respect. Finally, one of the other best things about utilizing this type of technology, and particularly being able to collect data and use data to tell stories, is that it really lends itself very well to social media these days. Everyone is kind of using social media. They're using it to, once again, show people in their community a bit about themselves, a bit about what they can expect in the services that they deliver and the people that they're seeing. So being able to communicate that effectively is more important than ever in that respect. So rather than, maybe kind of showing an exercise or talking about a condition or something like that, as an AxIT user, it's very, very easy to then show, okay, well, this is a client, this is how they presented initially, this is how they progressed. And it's a really engaging way in which you can use that, once again, to set yourself apart and show people how you get improvement in a lot of different presentations and help people achieve their goals in a range of different ways. Finally, of course, as well, AxIT allows you to provide some new services and generate potential new revenue streams in your business as well. So for a long period of time, assessment was probably a pretty unpopular part of what we do as health and fitness professionals. Usually it was the thing that kind of fit maybe somewhere in between some of the treatment services we provide and some of the exercise prescription services that we provide. And I think a big part of that was because for a long period of time, we just haven't had the tools and the technology to turn that part of the service into something that is actually really valuable and worthwhile. Now with tools like AxIT to be able to assess our clients' strength and power and the way in which they move, what it allows us to do is create those assessment-specific services that are really high valuable or high value services that we can provide. So, for a lot of our users, what they're starting to do is performing specific assessments. They may be 30 minutes to an hour long in duration. They run through a range of different tests, and at the end of it all, then once again, the client can receive a report on their results, and they're charging effectively for that. So it becomes a totally new revenue stream that wasn't really accessible because people weren't able to perform it effectively. A really great way, once again, to bridge the gap between, I guess, some of those more passive-based therapies, that a lot of us would do in a treatment room, and then engage our clients into maybe some of the more active-based services that some health and fitness professionals may provide, maybe in their own gym setting or maybe in an offsite gym setting or something like that. Once again, engaging those clients into those activities. By having that assessment in the middle, we can once again, we can show that client baselines in terms of where they're at, where they need to get to, and have those meaningful conversations. Beyond that as well, the versatility of AxIT means that it can be really niched into a lot of different specializations as well. So for a lot of our users as well, they're doing things like workplace type assessments, whether that be in more manual workplaces where they're using the tools to identify, once again, whether or not workers have the physical capacity for their jobs, or potentially using it more in a health and wellness setting, maybe in a corporate setting, to once again provide a valuable service in terms of enhancing productivity and general wellness, kind of services to that corporate. These are all options that once again some of our users have adopted when utilizing AxIT. Can also be used alongside other specific specialized niches. So, for example, I know a lot of health and fitness professionals these days are doing, say, running specific assessments or running specific services for, as we all know, runners, they love to do a lot of running. They tend to get injured, quite a bit. So there are a lot of certainly niche services around that. Or it could be, along other things, bike fit services, golf specific services, things like that. Adopting the tools and the technology, once again, to add more value to these services, to be able to show, I guess, where clients are at, where they need to get to, maybe where they have room for improvement. These are all kind of valuable additions that can once again set yourself apart. Finally, as well, the ability to generate contract-based opportunities as well, having the right tools to be able to win those roles, becomes really important as well. And once again, AxIT can help to set yourself apart if you are doing contract work with local sports teams or other organizations. This can be a really important way in which we go about it. So I'm hoping that gives a good general overview of, I guess, AxIT, the tools as it is, the force plate dynamometry products, and where it can fit for you, your clients, and your business. And certainly, happy to answer any questions that may be.
Great. Thank you so much, Andrew. Yeah, that was a great overview of the product. So yeah, we do have some questions to get going with. We have some pre-submitted questions, as well as some live questions hopefully coming through as well. So please feel free to pop those in the Q&A tab. Okay, so we did have quite a few questions, generally people coming onto this webinar wanting to learn more about the usability of the equipment and its functions, which you've definitely covered there. Particularly some questions around its use in physiotherapy settings. So if you're able to expand a little bit on how physios can bring this into their practice, how it's best applicable and how they can bring it in straight away to these sort of private clinics.
Yeah, absolutely. And it's a great question. I mean, at the end of the day, our main user group are certainly physiotherapists, although we do have, users across every different kind of health and wellness kind of profession. The main usability is certainly around, I think, that initial baseline setting in particular. I mean, a lot of our users will be using it in maybe initial appointments, initial consultations. So usually, maybe one or two different tests, depending on the presentation that the client has. And particularly, I guess, around that initial baseline. And then, as I mentioned in the presentation, that ability to show, hopefully, the positive impact of whatever that initial intervention might be. That's a really common use case. And, I mean, the classic example is, as I kind of said, rather than doing something like a manual muscle test of shoulder abduction because we have a client with a shoulder tendinopathy, maybe we're using one of our dynamometry devices to measure the exact amount of strength in both sides. Maybe we identify, a 40% imbalance from side to side because the sore side is deficient because it's obviously sore and the client doesn't feel like, or that sensitization doesn't allow them to generate much force through that side. And then we apply whatever intervention we feel is best suited for that client. That could be something like once again, some hands-on, some techniques, maybe some shockwave type treatment, maybe it's an isometric hold of some type to be able to reduce some of that sensitivity. From there, really, really quick and easy tool to be able to do a very quick reassessment, to be able to show hopefully that positive effect. And by having those numbers, we're no longer asking that client, okay, well, how do you feel? We're actually being able to show that effect, which is a real wow moment for a lot of those clients. It's a real moment where you'll gain some of that rapport and that trust with that client, where if we don't do that, we're really just asking the client how they feel. Look, they might feel a bit better, but they're probably still sore, and they're not sure whether they should all the pain be gone now, or should it still be there a little bit. It's hard for them to tell. So it does allow us to have that meaningful conversation. The other opportunity, of course, is then going beyond that. And so for a lot of our clients that we're dealing with, maybe some more complicated kind of rehab cases, or things where there is a bit of a rehab journey that's involved, or an exercise journey that's involved, it's obviously really, really important to be able to track that progression over time. So being able to show, in that client, say that return to sport from a knee complaint or something like that, being able to show them their knee extension strength, being able to measure the strength of those quadriceps, show that progression over time, being able to then determine when that client, based on their knee strength, whether or not they're ready to return to things like landing and jumping and running and all of those other kind of important movements, or being able to measure that client's maximum strength in a squat type movement in a safe and effective way. These are all ways in which using these type of tools can be really add an extra layer of insight to the practice that you're already doing. It really should be the type of thing that it's not necessarily about revolutionizing your practice, because you should already be doing a lot of assessment as it is, but it's going to add that objective layer to those assessments to be able to help you get better results.
Yeah, great. And I think, like I say, being relatable within your explanation of, the time, it's very quick way of being able to assess, and relating that to physio practice, let's say, when we can be quite, restricted with time and appointments, and that's a way that you can bring it into practice really easily. And then, let's say, all those bits of business opportunities and specific services that, physiotherapists and rehab practitioners can really focus in on using the tools specifically, like I say, for them at particular areas. Just quickly on the scope of clinicians, can you just quickly list sort of where else this can be suited for health and fitness professionals? Obviously mentioned about physios. It'd be good for people to hear, let's say, if they're, another a different health and fitness professional, like where, can they also be utilising it as well?
Yeah, well, that's one of the key strengths of AxIT, is that, we wanted to take the technology that, once again, the researchers and the very high level sports scientists were using in their day-to-day to measure elite athletes, that still had application for members of our general public and our lay person, but we wanted it to be usable for, once again, those everyday health and fitness professionals. So because we've really simplified the way in which it displays data, how you can then easily see through intuitive visuals, what that data means and how things are progressing. It really can be used by any health and fitness professional that is working with any type of client. So, for example, as you said, we have lots of physiotherapists using our equipment. Over here, particularly in Australia, we have a lot of exercise physiologists who use our equipment. We have osteopaths, chiropractors, myotherapists. We even have people who are involved in strength and conditioning or athletic training, or sports coaches. We have Pilates instructors. We even have massage therapists who utilize our equipment. Basically, if you have clients who can benefit from increasing their strength and moving better, then there will be tests that you can perform using AxIT to be able to assess that and assess the effectiveness of what you do.
Great, thank you. Okay, we do have a live question that's come through from Nicola. So hi, Nicola. So Nicola is looking at using a device for women's football specialists in ACL injuries. And Nicola's going to be looking at the device for prevention and risk reduction. So what is the estimate time it takes to screen a full squad? And she's also commented that it's been a great talk.
Look, it really does depend on the amount of people that you're screening and the amount of tests that you're doing in that screening session. So usually what we find is that probably if you're assessing a full squad, you're going to take probably a more generalist lens in terms of your assessments first and foremost. And then if you highlight or if you identify maybe any people in that screening that need further assessment, then you may delve a little bit deeper in terms of that. But in terms of like kind of football based assessments, particularly things around kind of knee strength and things like that, we're often looking at a leg extension type assessment. We might be looking at something like an isometric squat or something along those lines, if we can perform that, and then something like a drop jump assessment or a counter movement jump, something along those lines, in terms of those assessments. So 3 tests or so, if that was all you were doing with your squad, it should be the type of thing that each assessment may take maybe kind of a minute to a minute and a half to perform, depending on the type of test. So it should be the type of thing that you can assess each individual in under 5 minutes by the time you're kind of doing a couple of changeovers and things like that. So it's really quick, it's really fast to use, it's even faster to reassess because it does have simple functionality to just kind of review testing that you've performed previously. So it really lends itself very nicely to those situations.
Excellent, thank you.
Can I just ask a follow-up question to that one as well? Because this is one of the things we were talking about with some of our other technology. Is with this technology, it's amazing. You can do loads of different things with it. Trying to pick the best ones that are the best ones, again, whatever that means. But trying to pick tests that are the most suitable. We get a lot of questions around protocols and so on. What are your thoughts on trying to help people simplify and understand which tests might work best in their environment when they have got less time to be able to spend time learning the kit or so? Are there any quick things that you could suggest from that point of view?
I think the best thing to do is also look to the people who are doing a lot of this. So certainly I see lots of people working in elite sport, or lots of people working in other kind of sporting organizations or things along those lines, who will certainly be talking readily about what it is that they're looking for. And certainly there's plenty of research that gets done into sporting environments in terms of what is effective assessment and things like that. So I mean, depending on the obviously the type of sport and things like that, each test will be very, very different, or each battery could be very, very different depending on your resources. One of the beauties of AxIT, though, is because it is that integrated suite of force plates and dynamometers, really you have all the versatility that you need in one simple platform to be able to do almost any test. It's not like these are products where they only do 1 or 2 things really, really well, and then it means that you might need to utilize another product to do some other part of that type of assessment in that respect. So, but usually, I mean, as a general, keeping it simple is probably the best place to start. Everyone needs strength. There are usually some kind of key muscle groups that should be assessed for each different sport or each different activity, and then there'll probably be some other movements that might be more specific that you can also assess using some of the force plates and some of the other tools to be able to look at some of that.
No, it's great. I think one of the key reasons why we wanted to work with your product was the integration of all the kit. It's all native into that one software, and you can do everything with it. So that was a real key thing, is how do we make it easier for our clients to get quality objective data, but in a realistic time frame. So yeah, no, it's worked really well. Thank you.
Just on that with the question, so with the kit being able to produce this data, then we've had a somebody asked around sort of how's the data being calculated within the system, and what's the best way then to sort of transfer that or explain that to clients. Do you have any sort of comments on that?
Yeah, well, I mean, I think it once again comes back to our philosophy and our DNA from day one, which is about trying to keep things really simple and really usable for everyday health and fitness professionals. So, the way in which we see it is already as it is, the data is as intuitive and as easy to understand as you can possibly have, and what that typically means is that it makes it really easy to show imbalances. It makes it really easy to compare to evidence-based references to see where the deficiencies may lie. It makes it really easy to show progression with, once again, those intuitive visuals, or just even, kind of color-coded arrows that say if things are, improving or not improving, like that type of thing. But, it's something that we see that there's even more that we can do in that respect. And we've got some really interesting stuff that we're looking forward to releasing hopefully quite soon, that will once again make it even easier for the clients to be able to look at their results and clearly understand how they're going, maybe what they need to work on and stuff like that. So it's a big focus of ours. It's one that we appreciate the most. And, we really feel like we're going to continue to develop our product as the best tool, as a client-facing tool as well, not just something that's designed to extract, scientific metrics from, because at the end of the day, we're all in it for our clients first and foremost.
Yeah, absolutely. Okay, great. So we've just got a couple more. So a few questions surrounding, obviously there's similar bits of equipment and products in the market. So some questions were posed around, what's this kit sort of different to others that are out there? And how does it compare?
So, I mean, we really see this equipment, as we kind of talked about, sitting, somewhere in the middle. There's been equipment for a long period of time that is either pretty analog, probably lower in functionality, and whilst it will give you a number, it's not going to help you do any of the what I would call the features that smart tools will do. So it doesn't do a lot of the calculations for you. It doesn't compare maybe how one result is as a ratio of another result. It doesn't give a lot of the context around it, and certainly doesn't help with a lot of the reporting and the things that, or the additional features that are often really, really important. So that's one end of the spectrum. The other end of the spectrum, of course, is once again those tools that are very, very scientific, often 10 times the price, that type of thing. They're designed for researchers. They're designed for $1 million sports clubs, things like that. So AxIT is the tool that fits in the middle. It's the thing that takes, the best parts of those, higher end and more expensive tools, but also makes it really accessible and easy to use, in particular, for a lot of those everyday health and fitness professionals. So for those that are looking to upgrade just a little bit, just take one more step above, maybe if you are already using some of those simpler and, I guess, lower end tools, AxIT is the tool for you.
Yeah, great. No, that's great. And then lastly, just from my side anyway, was with regards to sort of requirements of training or sort of experience of practitioners. So is there any requirements for people to undergo using the kit, and then obviously resources and support which is available?
No, absolutely not. Once again, AxIT is designed to be really, really simple, really easy to use. For most of our individuals that are using it, it's the type of thing that as soon as they get their kit, they pull it out of the box, it's all ready to go, and they're already starting to test, because it does have that intuitive nature in the design of the product. And, for a lot of people, they're already familiar with a lot of these tests. As I said, this is just about adding an objective data layer to those tests and starting to measure from that. Beyond that, though, of course, if people do want to learn more and onboard themselves, part of the product is certainly a comprehensive training and learning portal that can help upskill not only the practice principals, but I like to think as well their staff. Hopefully it takes a bit of the burden off training up a team, when you can just direct them to some online learning that people can do at their own pace. But also, I'm sure the team at PhysiQuip, are well equipped to be able to kind of help and assist in some of that as well.
Yeah, absolutely. Let's say we're very much dedicated to onboarding and training, requirements that people need for it. But like I say, the online resource already existing for surrounding this is great. So like I say, we've got people getting up and running with it really quickly. Anything else from your side, Andy, before we wrap up?
From my side, I think Andrew's covered everything, articulated it really well. We've worked with really high-end and expensive tools before, which is, Noraxon products, which are absolutely outstanding. And just for the environment that we really want to help. So we genuinely want to help people's clinical outcomes, but also their businesses. And so trying to find tools that do that we do a lot of work into it. So we've been chatting with the guys from Strength by Numbers for over a year, and I just think this really aligns very well with what we're trying to achieve from all angles. So, really excited about it, and really looking forward to seeing where we go.
Yeah, absolutely. So thank you everyone for joining us, and thank you so much, Andrew, for presenting for us today, despite the time difference, of course, but we appreciate your time and expertise on this. So following the this session, everyone will receive the recording of the webinar for those who couldn't make it live. And if you want to get in touch with us about the AxIT system, then please head over to our product page, email or call us, and we're happy to discuss anything further. So thank you again. Thank you, Andy and Andrew. And then, enjoy the rest of your day.
Thanks again, guys.
Thank you.